I grew up in a family of physicians. My father was a doctor, my grandfather was a doctor, and it's something that seemed to come naturally to me that I was going to be a doctor. And it was more just with the interactions that you had with people. I know my dad enjoyed that part of his practice very much, having relationships with people. And ultimately it all came down to that for me. I wanted to do something where I could have a relationship with a patient, with a family, and something that lasted. It's not just about the surgery, which I enjoy. I love the technical aspect of it. I love the aesthetic aspect of surgery, but it's really understanding the person, understanding their motivations, their concerns, their fears, their aspirations. All these things help you achieve a better result. And plastic surgery in particular, plastic surgery of the face, I think is something that it allows you to really reach that level where you're truly understanding what a person is about, because the face is a reflection of their being, of who they are, and certainly what everyone sees. It's a very sacred part of your being, and I think that the ability to work with someone to enhance it, make them feel better about themselves, is something that just has an appeal that can't be replicated by any other practice or any other profession.
When I came in for the first consultation, he asked me what I wanted to have done. And I was more opted to ask him, what do you think I should have done? And he said, and this is what really impressed me, because he goes, it's what you want to have done and how you want to look. And I know Dr. Yalamanchili is very concerned with your whole overall being, just not getting your face redone and have these emotional problems maybe inside and you're doing it for the wrong reason. That's how I knew he really cared about his patients.
There's no such thing as a typical plastic surgery patient. What's interesting is most people who come in, always come in with sort of this idea of, I'm not really so concerned with my looks, I'm not trying to be vain, I'm not trying to do this for anyone else. And that's refreshing to me, and that's something that I look for, in fact, because I think it's important that people are doing this for the right reasons. And typically it's just about just feeling a little bit better, refreshed, looking how they feel inside.
I don't want anybody to look at me and say, oh, she had work done, okay? And I had stressed that to him, and he was very confident and conveyed to me that when he does these procedures, he doesn't do it. It's enhancement on your face, in how you look, in your beauty or whatever, and it's just good for him that he knows how to do that without making you look like you're had plastic surgery.
It's interesting because you're not going to make someone look like they're 18 or 21 again, and nor should you. And I think most patients also agree, because the end result, in order to maintain a natural result, you have to look age appropriate. And that can mean different things for different people, certainly. But it's not about just turning back the clock and saying, I want to look like I'm in college again, or I'm 25 again. It's more about looking refreshed, looking the best that you can, while looking yourself. I think more than anything else, what a person is most concerned with is looking natural, looking like themselves, and not looking like they've had something done. And that's something that I pride myself in encouraging if a patient doesn't feel that way, and certainly in trying to deliver those results.
The day of the surgery, when I was going to come in, I was excited about coming in. I had no apprehensions, or I had no stress, or I wasn't nervous at all. I was just so anxious and so excited to see the results, because I knew my sister had had such great results that it was great. And so then I went in there and I woke up and came out, and it turned out just wonderful. Once I had the procedure done, and I always wanted to look like myself. I wanted it to be a subtle, but for me, I would really know what, it was really effective. So when I would go out, people would look at me and they'd say, would you change your hair, or change your lipstick, and I said no. And to my close friends, I do divulge that I did have surgery done, and they were just so impressed. They go, oh my God, you look great, you look young, you look fresh, you're so alive and awake, and your face looks like it's so lit up. I had come in for my consultation, and I had told my sister how impressed I was with the doctor, and of course my sister always wants to do what I do because she likes to copy me, and so I said to her, I said, well, go in for a consultation. She came and she had the surgery done, and it came out beautiful. She looked great.
It really is about understanding what brings you to my office and what can I do to make you feel better and look better. And that means we're on the same page, and if we're on the same page, we're going to end up more often than not, I think very pleased because obviously it's important that I'm happy, but of course the most important thing is that my patient is happy. And I find that if we're looking for the same endpoint, the same result, more often than not, that's what happens.
I felt that I could call him at any time, before the procedure, after I had the procedure, and the follow-up was great because he has you come back quite a bit. And he called me the next day just to make sure that everything was, as a matter of fact, I think it was at night, if I'm not mistaken. And I was very impressed with that. So, yep, he's a wonderful surgeon. I have total confidence in him, and I would recommend him highly to anyone. I would not have any reservations to refer any of my friends or my family to him.